Well, Donella, Premier Ford is calling today's job numbers, which show Ontario has lost over 400,000 jobs due to the pandemic, a punch to the gut. He announced he is launching an Ontario Jobs Recovery Committee to help the province bounce back.
We must consider that things could get worse before they get better. And I know that it might be hard to see the light at the end of the tunnel right now, but we will turn the corner.
Now, yesterday, the Premier blasted the province's poor testing numbers and promised they would increase to 13,000 a day immediately. Today, just over 4,000 were completed. New guidelines will be announced tomorrow on who should be tested, but one mother says her 9-year-old son who has autism was not tested because he's different, and she worries vulnerable people aren't getting the same quality of care.
My son came down with 105 fever and a cough. It was very scary.
Kristen Ellison and her son Carter, who is on the severe end of the spectrum, went to Florida before March break. Several days after they returned, he became very ill.
He was so sick. My kid doesn't sleep. He bounces off the walls, and he laid in a bed, awake, but not doing anything, for like 10 days.
After consulting with an assessment center and calling her local hospital in advance, Kristen took her son to the ER. She was told he was presumptive positive, but the doctor refused to give him a test.
My son doesn't really love to be touched by anybody, so it was a bit of a struggle to get his blood pressure. And they basically said, you know, he looks worse than he is. And, you know, if he were more compliant, we would test you. But since he's being so difficult, you know, just go home, self-isolate for 14 days. And, you know, if he goes into respiratory distress, call an ambulance.
We told the Premier about her story. She's very concerned that vulnerable people, the elderly, people with disabilities, people like her son with autism, will not get the same level of care, will not be treated the same and get the same access. What do you have to say to her?
Well, first, my heart breaks to hear this story. I'd like to follow up offline with you if I could, Cynthia, and maybe get this person's phone number and give her a phone call personally, because that's not right. And anyone that goes to the hospital should be taken care of.
Kristen is not just worried about her son. Her 92-year-old grandmother's nursing home sent this letter to her family, warning them difficult decisions will have to be made and that under ordinary circumstances, ill residents would be sent to the local hospital. But in the wake of COVID-19, that will become very difficult. The letter warns ventilators can cause the elderly to suffer and asks relatives to think long and hard about what is in the best interests of their loved ones.
What is your concern with this letter, Kristen?
That our government and our hospital is allowing people to pick and choose who's going to get health care in this province.
Kristen's son Carter is slowly recovering, but life in social isolation with a child with autism is especially challenging.
It is a total shift in our reality. You know, this kid had therapy 5 days a week. He was doing amazing. The people who were surviving, just trying to get by, now don't have the tools they used to have. And it's really hard. It's really hard. And so people are flailing.
Very challenging for families. One more thing to tell you about from Queen's Park tonight. Premier Ford is urging people in Manitoba not to cross the border into Ontario this long weekend. He says the topic will be discussed in a conference call today with Prime Minister Justin Trudeau and other premiers.